Next question. This question in part also comes from a voter. Please clarify your position on the Affordable Care Act. And let's get past the support and opposed here, but what specific provisions make the ACA good policy or bad policy? We'll begin with Tom.
The ACA is not at all what I wanted. I wanted a very simple public option that would have gone like this. It would say that if you have an insurance policy that you like and it meets federal minimum requirements, which means that you can keep your child on the policy till he's 26, that the insurance company cannot cancel the policy because you have an illness, and that they can't put a cap on it, and a few other little things like that. If you have a policy like that and you want to keep it, more power to you. You can have it. Now, if you don't have that policy, we're going to sign you up for a government policy that's like Medicaid. We're going to sign you up. It's going to be taken, if you're not retired, it's going to be taken from your pay, just like Social Security, and you're going to be covered. And when you go to the hospital, you will have the same basic coverage as a Medicare type patient. Now that's what we need, a very simple public option. But as usual, the money makers got involved. Obama tried to accommodate them and put all this 20% profit margin in there, and so of course the rates went up, right? And we have so many things in the ACA that are not good, and because it's such a kludge. We didn't need a 1,200-page document. That's about what it is in legal type, and so it's. But now, having said that, having taken my shots at the ACA, it's the best that we got. March Group had a chance to fix it, make it better. Not one of them signed on the ACA. They didn't offer any suggestions. All they did was try to block it, and they're still trying to block it. So I say it's the best we've got at the time, and we will fix it. That's what Ted Kennedy said.
Repeal it.
Mark, your thoughts on public options, is that a possibility?
Well, I want Tom to answer one question, since not a single Republican voted for it, and big money got involved with ACA and messed it up. Which Democrats did big money get involved with? I mean, the fact is, not a single Republican voted for it. So if big money messed it up, let's find out who they are. And so, you got 1 minute rebuttal. You can answer then. And so, I've been very clear. You should have been able to keep your policy like the president promised. You should have been able to keep your doctor like the president promised. It should have been cheap like the president promised. None of those things were true. Now that it's here, and repeal is not looking proper. What we need to do is find some ways to make sure that we fix some of the problems. One of those answers came right here from Western Carolina, from your chancellor. Sitting in his office, he said, you know what we need to do? Is we need to make sure that student workers don't get caught up in this, because it's going to cost us millions and millions and millions of dollars. And you know, they're going to have to go without jobs because we can't afford to do that. And many of these students are working jobs to pay for their tuition. So what did I do? I went back and drafted a bill, a bipartisan bill. A bill that actually not only the University of North Carolina President Tom Ross supports, but a number of universities across. We talk about there's not bipartisan. I find the best ideas come from right here in my district. And that's one thing we need to do. We need to get rid of this 15-member appointed board that's going to decide who gets health care and who doesn't. We need to get rid of that. And we need to make sure that a health care decision is between a doctor and a patient, not the government.
Tom, where does the big money come from?
Yes, first, the last question first. Yes, we do have death panels. They're called insurance companies. We do have them. The ACA was written by Elizabeth Fowler, former chief lobbyist for WellPoint. Washington is floating in lobbyists. She sold her services to Max Baucus. She wrote the bill. Most of the people did not even know what was in it. And when she when it was passed, she moved into the basement of the White House and became President Obama's chief advisor on the ACA. And yes, there are Democrats who are culpable. They're capable of being involved, just like Republicans are capable of being involved. And so we failed, but we can fix it. The problem with Mark's group, they don't want to fix anything. They just want to throw it out, and we'll start all over, and we'll have all these people out there dying that don't have any care, and sorry, my time is up.
Mark, 1 minute.
I offer one thing that we're looking to fix. We're also looking at health savings accounts to make sure that we can fix that. But when we get about this, we talk about government providing health care. It hadn't been working too well for our vets. When you have a waiting list for our vets, when that's happening there, that's a government program. And you know what? I was told by the undersecretary, everything's working fine until the news broke about deaths. What we need to make sure of is that we make sure that health care is indeed affordable and that everybody has an opportunity to do that. But a government program that spends over $600 million on a website that didn't work, you ought to be worried if they're doing brain surgery, is all I can say.
All right, this is going to be our last question before we move to the closing statement.
30-second option here.
If you'd like 30 seconds, I can.
I like 30-second option.
All right.
I keep hearing all this talk about, we've got a plan, boy, we know where the hell is it? Okay? I keep waiting. Mark spoke to the town hall group at New Ridge Community College 2 years ago and was asked about what is the Republican solution. And he said,
Tom, it's sitting on Harry Reid's desk. That's where it is. I said it's sitting on Harry Reid's desk. That's where it is.
Please send me a copy, and I'll try to get in touch with
glad to.
Reid. I hear all these promises, and I hear all of this, and Mark's got all this wonderful legislation he's passed. I don't see it. And I really do study on the internet. I don't mean to be fantastic, but I read a hell of a lot, and I'm very well educated. I think I know what's going on in the world.
Mark, I'm going to give you 30 seconds if you'd like.
I think it speaks for itself.